Hello and welcome back. I'm Dawn Argula and I'm the CEO of the Livermore Valley Chamber of Commerce. Thank you for your patience as we work through technical issues. As we're live streaming this event, be patient. We'll always circle back with you. Thanks for joining us today as we hear from two healthcare professionals, Dr. Jake Scott and Chief Operating Officer Tracy Lewis-Taylor from Stanford Healthcare ValleyCare. Dr. Scott and COO Lewis-Taylor will provide us with a COVID-19 update and information on vaccines, testing, and facts about the virus and its effects on our health. Sincere thanks to our partners today. Thank you to Stanford Healthcare ValleyCare for its legacy of partnership and support of this Chamber of Commerce and for today's event. And thank you to Amos Productions and Jody Amos and his team for producing this webinar. The Livermore Valley Chamber of Commerce is fortunate to have both of these organizations represented on its board of directors and in its chairman circles. Today's event is being live streamed and recorded, and the video will be posted on the Chamber website at livermorechamber.org. Our speakers will each have an opportunity to present their information, followed by a short Q&A. Time permitting, at the end of the program, we will open it up to Q&A for both. Please enter your questions in the chat to be read later in the program. First, a bit of background on Stanford Healthcare ValleyCare. ValleyCare's origins date back to 1961 when Valley Memorial opened in Livermore. In the 1950s, St. Paul's Hospital in Livermore proved too small for the communities of Livermore and Pleasanton, and people grew weary of traveling to Oakland for health care. So local residents united and raised enough money, along with federal grants, to build Valley Memorial Hospital on land donated by Kaiser Paving Company in Livermore. And Valley Memorial opened its doors in October 1961 with 46 beds and a medical staff of 23. In 1991, ValleyCare Medical Center in Pleasanton opened, and over the years it kept pace with the growth in the valley, expanding to include new and remodeled buildings in Livermore, Pleasanton, and Dublin. And in 2015, Stanford Healthcare and ValleyCare became partners in order to grow the depth of services and expertise available to the community today. Today, this healthcare system remains a private, nonprofit, tax-exempt healthcare system. It is not publicly owned or operated, nor is it tax-supported, reinvesting any profits it makes from operations into new facilities, equipment, and services, rather than providing them to outside owners in the form of dividends. Stanford Healthcare ValleyCare's mission statement is to care, to educate, to discover, and its vision statement is healing humanity through science and compassion, one patient at a time. Love those. Now we'll get rolling with our program, and I'd like to introduce Dr. Jake Scott. Dr. Scott is a board-certified infectious diseases specialist. He provides a general infectious diseases care in the inpatient and outpatient settings, and his special interests include COVID-19, multi-drug resistant organisms, and HIV, to name a few. He is co-medical director of the Antibiotic Stewardship Program at Stanford Healthcare ValleyCare in Pleasanton and a member of the Infection Control Committee. Welcome, Dr. Scott. I imagine this to be an especially busy time for you, so many thanks for being with us today. So, turn it over to you.
Thank you so much. So, I can't see my slides. Oh, there we go. Okay. So I'm going to touch on COVID-19 vaccines and also discuss the latest news about some of these variants and what the sort of takeaway is. So to begin with, I do think it's very important to recognize that things are moving in the right direction. So the winter surge, I think, is behind us. I can safely say that. The number of COVID-19 cases throughout the country and in California, as well as the Bay Area, have continued to decline at a very steady rate. I spend a lot of time working in the hospital, seeing hospitalized patients, And these days, for the last year, it's been a lot of COVID-19 patients. And I have seen firsthand a dramatic decrease in the number of patients requiring hospitalization for COVID-19, and it's quite a relief. So this is just some latest information from the California Department of Public Health, which shows the decline in the number of cases as well as the number of deaths. We are also seeing throughout the state a decrease in the level of hospitalization for COVID-19 patients. And vaccines have been distributed at an accelerated rate. California has administered 6.4 million doses, and Alameda County has administered more than 200,000. So vaccines, I consider vaccines to be one of the greatest medical breakthroughs of all. They've been around for a while. The principles of vaccines, at least, have been around for a while, going back to around the year 1000 in China. And the first vaccine that has been used clinically with great success was actually discovered in 1796 by Edward Jenner. He had used a cowpox virus as a smallpox vaccine. Vaccines have saved countless lives throughout history. The World Health Organization estimates that vaccines have prevented around 10 million deaths just between 2010 and 2015. Deadly diseases have been eradicated thanks to vaccines, including smallpox, which killed about a third of all patients who had acquired it. And smallpox was eradicated. The last case was in 1977. As far as how vaccines work, they basically work by stimulating the immune system to recognize any foreign pathogens and to protect us from them if we were to be exposed. So the COVID-19 vaccines that are available in the United States are the Pfizer and the Moderna vaccines, and both of these are mRNA vaccines. mRNA stands for messenger RNA. And if you remember from high school bio or any other courses you've taken in genetics, DNA is what I consider the genetic blueprint. And DNA is then transcribed in the nucleus to RNA, which I describe as basic instructions, which allow cells to make proteins, which serve various functions. The use of messenger RNA for vaccine purposes has been studied for a long time. This is not something that is brand new technology. It was first looked into for the purpose of vaccines in 1989. It's been studied in a number of different infectious diseases, including influenza, cytomegalovirus, rabies, even some other coronaviruses, including MERS-CoV, which is the Middle Eastern Respiratory Syndrome coronavirus. I think it's very important to know some of the basics of the vaccine in order to dispel some of the myths out there. Initially, when the vaccines were being rolled out, I heard a number of people express concern that they had heard that the vaccine could integrate with their genome, their DNA, and lead to a number of problems. And that's not true. It's biologically impossible. Messenger RNA vaccines remain outside of the nucleus. They don't interfere with DNA, and they are quite safe. It's also important to know that this is basically a small molecule of what we call nucleotides, which are simple instructions that, and it's a very simple molecule. These are molecules that circulate throughout our cells at any given time by the thousands. And these are also molecules that are quickly broken down by our cells. There are enzymes within the cytoplasm that break down this molecule within a few hours. So the mRNA vaccines, once they are taken up by cells, they're actually degraded quite rapidly, or at least within 24 hours. And these are not pieces of the virus, and the messenger RNA does not encode for the entire virus. It just encodes for a particular protein. So I have heard a number of people express concern that maybe the vaccine could give them COVID, and that's biologically impossible. So the messenger RNA is basically, like I said, a string of molecules that instructs the cells to make one particular protein. And that's the spike protein that the virus uses to attach to our cells. And I think of the spike protein as sort of like a key that is required to turn on the engine of infection. So the RNA gets translated in the cytoplasm by the ribosomes, and then a spike protein is made. That gets excreted to the surface of cells. Those proteins get recognized by our immune cells, taken up into the local lymph nodes, which is partly why some people have some swollen lymph nodes after the injections. And then there are a number of different events that lead to a very complex array of immune defenses. So B cells that make antibodies, T cells that help B cells, et cetera. It's quite complex, but there's a lot more to it than just antibodies. And these, I should say, the RNA itself is quite fragile. It gets broken down quite quickly. So in order for it to get taken up or to make it to the cells, it has to be packaged in some sort of device or packaging material. And what they came up with was quite ingenious, I think. It's a lipid nanoparticle. It's simply a very, very small, hence the term nano, particle that's made up of fats and sugars. And that basically just protects the RNA from getting degraded before it enters cells. And then that lipid nanoparticle just sort of melts away, gets easily metabolized, and then the RNA itself gets excreted into the cells. My phone froze. Here we go. Oh, I lost my clicker connection. Oh, there we go. Sorry. Okay, so the vaccine trials for the COVID-19 vaccines went through the trials that are typical of any vaccine. So understandably, I think initially there had been some concern that the vaccines were rushed through trials. And I think it's important to know that these were not rushed in the sense that any corners were cut. The trials were expedited. They were compressed. So the vaccines were studied extensively in the manner of your standard sort of vaccine trials, going through phase 1, phase 2, and phase 3. These were very large trials, but Operation Warp Speed and the massive amount of funding, there was about $24 billion that went into these efforts, allowed the vaccines to go quite rapidly through the trials, rather than relying on, say, individual investors to support the vaccine trials. The money was put up front, essentially, and allowed the companies and hundreds of scientists around the world to develop these vaccines and to study them at an accelerated rate. And that's because we were dealing with and continue to deal with quite an emergency. So it is important to know that these were very large trials with absolutely excellent safety standards. All right, getting a message. So there are a number of other reasons why the vaccines were developed so quickly, and they were developed quickly. These vaccines were made in record time and were made available in record time. And that's also because not only was there a lot of funding that allowed for the vaccine trials to be compressed, but there was also the manufacturing that was initiated even before the vaccine trials were completed, with the hope that they would work. And sure enough, they do. They work quite well. But again, these vaccine trials were held to the same safety standards. So as far as the trials themselves, the Pfizer trial included 45,000 volunteers, Moderna 30,000 volunteers, many different sites. The Pfizer trials, both of the trials, I should say, included a very diverse range of volunteers across the spectrum of ages. For the Pfizer vaccine, from 18 years up, and for the Moderna vaccine, 16 years and up, and represented a very diverse group based on different races and ethnicities. So when it comes to the emergency use authorization that was issued after a significant time had lapsed so that safety data was available. So a common concern that I hear is, well, we just don't know what it's going to be like in terms of any long-term complications. Well, historically, every serious complication related to vaccines has been has basically manifested within, on average, 6 weeks of administering the vaccine. So when the FDA issued the emergency use authorization, they had already had 8 weeks of safety data starting from the second dose. So they had a good 3 months of data. And since all vaccines with any complications are seen before then, I think that we can be rest assured that there should not be any unanticipated consequences. These vaccines do stimulate the immune system to the point where a number of people quite commonly do experience some uncomfortable symptoms. After the first dose, it's very common to just have pain at the injection site. After the second dose, the booster dose of both the Moderna and the Pfizer vaccines, it's quite common to have various sort of flu-like symptoms. They're typically mild and can include low-grade fevers, temperature of 100, etc. Headache is quite common, chills, fatigue. These are symptoms that typically last about 24 to 48 hours. They're not a sign of the virus having infected someone, because, again, that's impossible. These are signs that the immune system is responding and that you are essentially, I would say, earning your immunity in a sense. So it's kind of like working out of the gym and feeling sore the next day, and that being a sign that that things are actually working. Sorry, my clicker froze again. There we go. My phone shuts down, the clicker stops. Okay. So a common question I get is, so I often hear my mom has an inflammatory condition or an immune condition. Is she still able to get the vaccine? Well, the answer is almost always yes. There's really only one contraindication to getting the vaccine. And by contraindication, I mean there's only one reason why you might not want to you might want to talk to your doctor before receiving the vaccine, and that is if you have a history of a severe allergic reaction called anaphylaxis to some of the ingredients in the vaccine, such as the polyethylene glycol, also known as PEG, which is quite uncommon, or if you've had a history of a severe allergic reaction to the vaccines themselves. Anaphylaxis to these vaccines has been quite rare, occurring in about 3 per million people who've gotten the Moderna vaccine and about 5 per million in the people who have received the Pfizer vaccine. So even though the trial, the phase 3 trial at least, has completed in terms of enrolling patients, they will continue to closely monitor safety data. So if there are any significant adverse reactions that develop down the road, these volunteers will be monitored for a number of years. There are existing safety data systems that have been employed, and there have also been new safety systems that we can use quite easily with various technology. So how effective are these vaccines? Well, I'm sure a lot of us have heard now that both the Pfizer and the Moderna vaccines are 95% efficacious. And that means that when you compare compare the volunteers who received the vaccines in the trial to the people who received the placebo, the people who received the vaccine had a 95% chance of 95% less chance of actually getting symptomatic disease. So the trials were not able to detect asymptomatic infection, and that's because they just didn't have the resources to do frequent PCR testing on, say, a weekly basis. So what they did was they had patients report whether or not they developed symptoms, and then, of course, if they developed symptoms, then these individuals got tested. So they're 95% effective, in a sense, at preventing symptomatic disease. They are about 100%, as far as I know now, and the data is constantly evolving, but about 100% protective in terms of preventing severe illness requiring hospitalization and death. And I think that's really the big takeaway, is that these work very well, far better than any of us had anticipated at preventing severe disease. So how long does the effectiveness last? Well, we simply don't know, and we won't know until time allows us to monitor more data. If I had to guess, I would guess that they would work at least 6 months, hopefully a year, maybe even a couple of years. But no one really knows for sure. Time will tell. I went through that. So there are a number of different vaccines that are being made available throughout the world. The United States has the Pfizer and Moderna vaccines. The next vaccine that will likely be approved is the Johnson & Johnson vaccine. And again, it's just important to emphasize that these vaccines, I think, really have been a home run in terms of how effective they are at preventing severe disease that would require hospitalization. So they're all essentially 100% effective at preventing COVID-19 that would be severe enough to require hospitalization and death. There have been a few cases of patients who had received the vaccine requiring hospitalization, but the latest I've heard is that there have not been any deaths. And it's also important to know that no vaccine is 100% effective. So we can't expect 100% effective in terms of preventing any disease. But these vaccines are going to make a dramatic difference in the number of people getting really ill. So now that we have these vaccines that were made in record time, that are incredibly effective, and that are extremely safe, I think it's really important for everyone in the community to do what they can to counter any sort of misinformation, and to really talk to your physician, reach out to various resources if you have any particular concerns, and hopefully I can address any questions. I will say that unfortunately there's been quite a bit of misinformation on social media and the news, and there's been a lot of reluctance to get the vaccines. And I can understand why in many ways. I think that vaccine skepticism is understandable. These, again, are new vaccines using a new technology that had never been used, at least commercially. So I think it's important that we be transparent, that that we communicate about everything we know about the vaccines and give people a warning that there are these very common reactions, etc. So the variants of concern. Uh, Viruses will always mutate. It's inevitable because they replicate at such a rapid pace. And when they replicate, they tend to make some mistakes. And those mistakes can lead to mutations. Most of the time, these mutations do not lead to any change in the way in which the virus behaves. So they're mostly insignificant. Every once in a while, the vaccines will develop a combination of mutations that can lead to the virus becoming more genetically fit. So it's normal for viruses to evolve at a very rapid rate, far more rapid than any other organism. But it's not necessarily that the virus itself is unique in this sense. I think that it's important to know that it's the epidemiology that's driving the number of these variants. And variants just refer to different uh, uh, SARS-CoV-2 viruses that have a number of mutations in particular that can lead to differences in terms of how it spreads or how it affects people. So early on in the pandemic last spring, we were made aware of a variant called the B1 lineage, or the D614G variant, and that refers to the particular amino acid changes. And as time went by, we were able to gather more information about this particular variant, and it does appear that this variant has been more contagious in a sense. It's not quite clear exactly how it is more contagious, but it is the general consensus now that it has been. But so the D614G variant essentially dominated the various other variants and became the most common SARS-CoV-2 virus. Then last December, the United Kingdom had detected another variant, which we refer to as the B117 lineage. It's sometimes referred to as the UK variant, but it's important to know that that's just because the UK was the first to detect it. It's not necessarily the place of origin. And this variant has a mutation called N501Y, which does seem to lead to a number of different ways in which it interacts or infects people. So this variant does seem to be about 30 to 50% more infectious than the previous variants. It's spread globally, and there is a fair amount of it in the United States. Other variants are the B1351 variant, which emerged in South Africa in December. And like the B117 variant, this also seems to be more contagious or more infectious. We also describe it as more transmissible. And the difference between the B117 variant, which is the so-called UK variant, and the South Africa variant is that this one, as well as the Brazil variant, the P1, do appear to lead to slightly reduced effectiveness when it comes to a number of different vaccines based on studies. The mRNA vaccines, I don't believe, will be rendered less effective by these particular variants for a number of reasons. Largely because these mRNA vaccines are so effective that there's what we call a cushion or some wiggle room. So if there's a reduction in efficacy based on, say, a neutralizing antibody study, that reduction most likely won't be significant enough to lead to an ineffective vaccine in the real world. So that is the end of my presentation, and I'm happy to take any questions.
Okay. Thank you, Dr. Scott. It looks like we have questions in there, but it seems that the burning questions have to do with the deployment of the vaccine, which I know that Tracy will be covering in her presentation. But just to be clear, thank you very much for that, the information on those slides. I think there were a lot of burning questions that you answered. We hear these are common questions that we hear from our members, our member businesses, just amongst my staff, other people that I've spoken to. So we really appreciate what you put on there. Just to be clear, I have a question on the variants. The protection, if you have the vaccine and you've had both, you are protected from the variants if you are vaccinated, correct?
Yes, correct. At this point, if you've been vaccinated with either the Pfizer or Moderna vaccines, I have no reason to believe as of now that you will be less protected if you come across one of these variants. So either the South Africa variant B1351 or the Brazil variant P1. But I think of these variants as a sign, basically a sort of warning sign that should tell us that we really need to do everything we can to vaccinate people as quickly as possible, because there are likely going to be more variants detected, and the virus will continue to evolve as long as we have ongoing spread throughout our communities. And you know, there's a potential for a new variant to arise that could be more resistant to even the current vaccines. One great advantage of the mRNA vaccines, the Pfizer and Moderna vaccines, is that it can use the technology to modify the vaccine to become more effective against variants as they arise. So it's a nimble technology in that sense.
Okay, thank you. After you receive the vaccine, can you still be a carrier of the virus and not know it?
Great question. So we don't have all of the data to really know with 100% certainty. That being said, based on some of the data that we do have at this point, it does seem pretty certain that these vaccines will lead to a lower risk of spreading the virus. So if someone got both doses of the vaccine and were exposed to the virus, there is a chance that they could get an infection. I think that chance is quite low. And there's, I think, a very small chance that they could then spread it. So for now, as long as the levels of COVID-19 remain high in the community, I think it is very important that even after vaccination, that people continue to practice the same precautions we've been practicing. So wearing a mask when in public in particular, practicing physical distancing, etc. So I think that it's important to know that just because we don't know for sure that the vaccines will prevent transmission, I do have reason to believe that they will reduce that risk. So that's another huge advantage of the vaccines and another good reason to get vaccinated. But it's not going to be 100%.
Okay. Do they anticipate that this may be virtually eradicated once we get everyone vaccinated, I imagine, yeah.
Yeah, unfortunately, this is, so there are other coronaviruses that have been circulating through humans for thousands of years, and they make up about 25% of the common cold. So there are various viruses that make up the cold, and there have been 4 human coronaviruses that are common causes of the common cold. Since 2000, there have been 3 animal-borne coronaviruses. So the original SARS in 2003, and then MERS in 2014, and now SARS-CoV-2. And I think that SARS-CoV-2 in particular so SARS-CoV-1 in 2003, that's been eradicated. But I don't think that'll be the case with this one. I think that this will become what we call endemic, meaning it will continue to circulate throughout humans for years to come. But I think that it'll be rendered basically fairly insignificant, hopefully as weak as the common cold, but maybe as potent as influenza. But that's another reason to make sure that as many people as possible are vaccinated, because if we're all vaccinated, then our chance of suffering from severe illness will be significantly reduced. But I don't believe that it's possible to eradicate SARS-CoV-2.
Okay.
But that's not as bad as it sounds.
Okay. I know it's pretty scary times right now. We're just afraid of everything.
Yeah.
Anything you can tell us about the process for vaccine for children?
Great question. I believe that they won't be safe in children, but there's just not enough data for the FDA to approve it. So again, they included 16-year-olds and up in the Moderna trial and 18-year-olds and up in the Pfizer trial. They are studying the vaccines in kids aged 12 to 17. Hopefully we'll have that data in a few months. For kids under 12, I think it'll be a while before we have any clear safety data. But again, biologically, I have no reason to believe that it would be unsafe. I think that the main challenge will be determining the right dose, et cetera. But hopefully kids will be able to get vaccinated within the next year. I think that would be great.
Okay, Dr. Scott. So I think we'll move on right now and give Tracy some time to do her presentation. At the end of the program, we will come back and ask more questions. So if you haven't heard your question be asked yet, we will circle back with that at the towards after Tracy's done with her presentation and her portion of the Q&A. All right. So now turning to Chief Operating Officer Tracy Lewis Taylor. Tracy has been the COO of Stanford Healthcare ValleyCare since February of 2017, and she is responsible for providing strategic leadership and management for all hospital operations, including human resources and nursing operations. In addition to her role as the COO, Tracy serves as the 2021 board chair for the Pleasanton Chamber of Commerce, our neighboring chamber and partner. Previous to Tracy coming to California, she served as vice president for operations for New York Presbyterian Lawrence Hospital, overseeing its operations as well as capital budgets and implementing clinical strategy. She served as director of clinical services at New York Presbyterian, responsible for operations of the oncology and cardiology service lines. She joined them in 2006 as a Six Sigma Black Belt. I don't know what that is, but be happy to hear what that is. And she has held roles with Tenet Health Systems and the healthcare consulting firms of Capgemini, Ernst & Young, and Arthur Andersen. Welcome, Tracy. Thank you for taking time out of your busy schedule for being with us today. And I know that you are going to be answering a lot of questions. We got a lot of questions in here about deployment of the vaccines. And that's in your area of responsibility. So with that, Tracy, take it away.
Dawn, thank you so much. It's really a pleasure to be able to talk to this particular group, and certainly big shoes to fill following Dr. Scott. There are several questions in the chat, so I'm going to do my best to weave in those questions and answers during some of the slides. But certainly as more questions come in, I'm happy to take those at the end as well. I do think of vaccines as, sort of the light at the end of the tunnel. It's one mechanism for us to return to a sense of familiarity or stability. And Don, as you noted, as board chair for the Pleasanton Chamber of Commerce, I really do believe in the prominent intersection between the health of our business community and the physical health of the residents of the Tri-Valley. So it really has been just such an amazing component of my career to blend these two objectives so concretely. So I'm going to talk a little bit about just sort of where we are with current state of COVID. I've got a slide in here that mimics what Dr. Scott presented as well. So I'm glad that we're both paying attention to the same data elements. But I think, as Dr. Scott noted, we've seen some really positive trends here in the Tri-Valley, specifically in Alameda County. And these are things that we watch very closely, just in terms of what's happening in our communities and how that might impact our day-to-day hospital operations. So I think it's important just to share with you, again, a slide that we watch daily. It's a slide from the CDPH, the California Department of Public Health website. And what you see here on this slide is, as we all felt that peak or that surge in COVID cases that occurred towards the end of December and early part of January, we've certainly seen in the last 4 to 5 weeks that the trends have been improving. Our positivity rates have been decreasing, our inpatient cases have been decreasing, and our ICU cases have been decreasing, which is really great news. So I just want to acknowledge the effort that's put in across our community to make sure that we are preventing transmission and spread of the disease. I will also just acknowledge that at Stanford Healthcare ValleyCare, we have really effective safety protocols in place. So incredibly safe care that's being provided. And through this entire pandemic, dating back to March of last year, we have not had any changes to the services we've provided. In fact, we've added additional services to create more ease of access, and that includes services within our urgent care and physical therapy areas being provided through telehealth options. So from the comfort of your own home, you can access our urgent care or our physical therapy locations. So those are some great things that we've added to be able to support our community more broadly. Do you want to talk a little bit about, obviously, vaccines and sort of what that means for us as we go forward? And sorry, I don't think I'm actually paying attention to my clicker, so perfect. Okay, so this is the same slide that Dr. Scott shared as well. And so I'll just briefly, again, share with you that we very much pay attention to what's happening around vaccine distribution. I'll draw your attention to the website at the very bottom of this particular screen, public information. You can sort of see how we as a state and we as a county are doing with regard to access to vaccines. You'll notice here within the center of the screen, 8.7 million doses shipped to the state of California. And at the very top, 6.4 million doses have actually been administered to date. And then on the far right-hand side, that information is broken out by county. So it just gives you a little bit of insight into how well we're doing. You can sort of marry this with what we see on the news. Perfect. So next slide just shows, again, this information really at the county level, showing that we have administered just over 260,000 doses to date within Alameda County. And I think what's really top of mind for most folks, perfect, thank you, is who's eligible. And this was one of the questions in the chat. So I'm going to talk a little bit about the framework. And I first want to acknowledge that state of California Department of Public Health issues a broad framework by which the state of California will begin to vaccinate our residents. Each county then has the opportunity to fine tune that framework ever so slightly. So staying within the guidance of the California Department of Public Health, the counties then set out the timeline by which we would expect to move through the phases. So here in Alameda County, what you'll notice is that we are currently vaccinating individuals who fall into phase 1A as well as 1B. 1A, healthcare workers, as well as long-term care residents. Phase 1B is inclusive of individuals who are 65 and older, as well as starting last week, in Alameda County, we've been able to vaccinate folks that are within the sectors of food and agriculture, education and childcare, as well as emergency services. So our law enforcement personnel is a great example of that. We do expect, based on what we're hearing through the California Department of Public Health, the state, beginning March 15th, healthcare providers may use their clinical judgment to vaccinate individuals who are aged 16 to 64, who are deemed to be at high risk of getting sick from COVID-19. And so if you go on the California Department of Public Health website, you can see what constitutes high risk individuals. You can see the various comorbidities Oncology certainly is one of those. Additionally, diabetes and some other comorbidity conditions. What's important to note, though, is that counties still, while following the state plan, may move through the tiers at a different pace. And that's generally speaking based on the population of individuals who fall within those different tiers, as well as the number of doses that they have access to be able to vaccinate the populations. So the best advice is just to stay connected to your individual county website. I assume that most people are listening from Alameda County, so please stay very closely connected to the Alameda County website for additional information around eligibility and timelines for inclusion. Oops. Perfect. So I mentioned Alameda County. And again, right on the Alameda County website, I noted the link at the very bottom. There are several ways that you may access vaccination, again, based on eligibility requirements. So I think notably, certainly within your healthcare provider, Kaiser, Sutter, certainly Stanford Healthcare and Stanford Healthcare ValleyCare are offering vaccine appointments. I can speak specifically to Stanford Healthcare ValleyCare as well as Sutter Health, and I'll explain more about that in a moment. But with these two health systems, we are offering vaccine appointments to not only individuals who are patients of ours, but to members of the broader community. And the reason I'll speak specifically about Sutter and Stanford, and I'll share this with you on the next slide as well in just a moment, but we recently activated a large-scale vaccination site at the Alameda County Fairgrounds. We launched officially yesterday. We had a soft go live on Monday. And this footprint does allow us the opportunity to vaccinate anyone, regardless of where they get their primary healthcare services. We do obviously intend to continue to follow the tiers that were set out by the county. In addition to our site here at the county fairgrounds, the county has activated a mega site. It's actually a partnership with Cal OES and FEMA. And that site launched, I believe, Tuesday at the Coliseum. So it says February 16th as planned. So again, information right at the bottom of your screen about where to get a vaccine and how to link to the various health systems or entities regarding appointment scheduling. Thank you. So just in terms of what we've been doing here locally at Stanford Healthcare ValleyCare regarding vaccine distribution, we do have access to both Pfizer and Moderna. Again, we get our supply directly from the county, so the quantity that we get is not necessarily always up to us. We get what the county distributes to us. And I think we've sort of perfected our vaccination program. We've been at this now 2 months today as I look at the calendar. We started mid-December vaccinating our own healthcare workers, and then just in the middle of January expanded that vaccination program to offer vaccines to other healthcare workers. So those that were maybe outside of the Stanford healthcare system, parts of our community, non-affiliated healthcare providers and the like. And then shortly after that, we launched our program to vaccinate our patients and the broader community. Again, staying within the framework of Alameda County, we are vaccinating individuals who are 65 years and older. Right now, we actually offer two footprints within the county, one at Emeryville, which is run by our partners over at Stanford Healthcare, and then certainly the locations that we have here in Pleasanton that are operated by Stanford Healthcare ValleyCare are, if you've already received a vaccine, first vaccine, right on the main campus of the hospital, our 5565 West Las Positas building, you may be eligible to receive your second vaccine in that same location. All new first appointments will be scheduled over at the Alameda County Fairgrounds. As I mentioned, that was a site that activated officially yesterday. We are offering appointments Monday through Saturday, and I would almost argue that we have new appointments being activated every single day. So we're being a little bit careful in how many days out we're booking, But my advice, regardless of where you get your vaccine, is to check those websites daily for appointment availability. Like I said, we've added new appointments every day, and we will continue to do that for the foreseeable future. And again, I'll reiterate that the site that launched at the Alameda County Fairgrounds does allow for opportunity for appointments to be made for those patients who are patients of Stanford Healthcare, as well as to anyone in the community following the tiers. One of the things I think is really important, and I'm glancing at the chat just to make sure that I cover the question. There's a question about where to get a second shot. This is a little bit of a tricky question. I think it depends on the healthcare organization. But my advice is that it is best to receive your second shot, second dose in the same location that you received the first. And some of that is influenced by manufacturer. But in all honesty, we're getting doses allocated to us based on the administration of our first dose. So just from a logistics perspective, it is much easier when we have folks receive their first and second doses in the same footprint. So for our Stanford healthcare system, we are requiring the second dose to be administered in the same location as the first dose. Certainly, if there are any concerns or other barriers that may prevent this, we will absolutely take those considerations on a case-by-case basis. We have a website that can be accessed, or a phone number to our call center, and all of that information is directly on our ValleyCare.com website. And speaking of our website, I wanted to make sure that I shared a screenshot from ValleyCare.com. There's a link to get more information about vaccines, including the link to schedule an appointment, as well as the phone number that you may call if you don't have computer access or otherwise are having challenges getting online. So I think that was actually the last question. If you don't have internet or email, this phone number right here presented on the screen or directly from our website will help you get an appointment. And I know we're right at 1 o'clock, so I want to be respectful of time. I'll pass it back to you, Dawn.
Thank you, Tracy. So the program does run until 1:30 is what our schedule is. So we do have some time here. Do you have more before we go into Q&A?
That's what I have in terms of the formal slides. I am reading the chat as well, and I absolutely appreciate the frustration around messages that you're hearing that there are no appointments available. I myself have parents that are in their 80s and really struggled trying to help them to get a vaccine as well. They live in the state of Florida, so a little bit more challenging for me to understand how that state was working and how that was different than California. But I ran into the same challenges. Every healthcare provider that we went to, we would hear or read no appointments available. What I will reiterate again, at least for Stanford Healthcare ValleyCare, we add new appointments daily. So right now, if you go on our scheduling portal through My Health or call our call center, we have appointments that are set up, I believe, through Saturday. We will continue to add appointments for Friday, for Saturday, for Monday, for Tuesday, every day. So I know it's frustrating, but we will, what we're trying to do is make appointments based on the quantity of vaccines that we have or that we're expecting to get, so that we don't run into a situation where we have to start canceling appointments. And so it's all of our appointment scheduling is based on vaccine supply and availability. But I would say every day, go online. And if you want a little insider information, midday is probably the best time. If you think about, give you a little inside tip, the schedules are not automatically activated. Somebody has to go in and release those appointments, which means typically our teams are working, Monday through Friday, 8 to 5-ish business hours. So if you think about when new appointments get released, definitely during that window.
Okay. And Tracy, are you referring to just patients of Stanford Healthcare ValleyCare or anyone to schedule
Anyone.
through your lines? Anyone.
Anyone.
Okay.
Yep. So if you already have a MyHealth account, if you're already a patient of ours and have a MyHealth account, you can access your MyHealth account via app or via the website and go ahead and schedule an appointment. If you aren't a patient of Stanford Healthcare ValleyCare or Stanford Medicine at large, you can still create a MyHealth account and schedule your appointment electronically. And additionally, that 650 number that was on our website will connect to our centralized call center. And there are individuals who are able to access the schedules in each of the different locations and help to facilitate an appointment. There's a question in here about the phone line saying to schedule online. I'd love to learn more about that. So it's I'll say easier or faster sometimes to schedule online because you can sort of control the search features. But that is that phone number that I referenced on our website, 650 number does allow anyone to schedule through a phone system, not online. And I'm going to bring up that phone number because I don't know it off the top of my head. So bear with me. 650-498-9000. 650-498-9000.
Okay. And is that the same number to schedule to go to the fairgrounds?
Yes.
As well? Okay.
Yep.
Very good. And there is a question in here about someone who had their first shot at the Emeryville site, and they live out here, and they'd like to know if they can come to Stanford Healthcare ValleyCare for vaccine number 2.
Yeah.
Is that an option?
I wouldn't say that's my first option. Right now, we are asking individuals to receive their second shot in the same location that they received their first. And some of that, again, is really just based on logistics and supply management. That may change as access to more supply becomes available over the next several weeks. But for now, unless there is a significant barrier to going to Emeryville, my advice would be to stay at Emeryville and to receive the second dose there.
Okay.
I would say the same with rescheduling appointments. We get that question a lot as well. Somebody has an appointment and they want to reschedule it. I will acknowledge it's not the easiest thing to do. So the best bet is if you have an appointment in a location, go.
Mm-hmm. Okay. And we did have a question in here about someone, a 76-year-old female with cancer who cannot get an appointment for her vaccine. Didn't say which healthcare provider or anything like that. What advice would you give to this individual?
Sure. So 2 pieces of advice. So generally speaking, I will say the age criteria and the oncology diagnosis or any other comorbid conditions are really looked at independently from the state's framework perspective. The state and the counties are vaccinating individuals who are 65 and older. So that right there should help to facilitate getting an appointment. There's an eligibility criteria that is met just by the nature of the age. But like everybody else, it does require getting an appointment. And so going through the different healthcare systems and using information that's on the county website to find appointment eligibility.
Mm-hmm. Okay. And that website again was covid-19.acgov.org. And you can navigate through there. Here's a question on the supply. So the state receives its allocation of vaccine, and then they allocate to the 58 counties throughout the state of California. And then the counties then distribute to the local um, distribution points, healthcare providers. So the question is what is the bottleneck in the distribution, in your view, to your knowledge? Maybe we can help shake that loose. I don't know.
Yeah.
I know this is a supply issue, but.
Yeah. So I think what's I don't know if I have a magic crystal ball to understand the distribution challenges across the state or even across the entire county. But I think, Don, to echo something that you just said is really important. There's an allocation that goes to the state. And let me first acknowledge that the state then allocates doses to some healthcare systems. Those systems, it's what's called multi-county entities, MCEs, which really mean healthcare systems that operate in multiple counties. So rather than having to get doses from each of the individual counties, they get doses directly from the state. From there, right, whatever's left, right, the unallocated portion, then goes to, as you described, each of the individual counties. The counties then also hold some doses for their own distribution channels. So their Department of Public Health will have a vaccination site, and then additional doses will then flow to different.
Maybe after this one, let's see.
Yeah. So they'll flow to the different healthcare providers. So right now there's a multi-tiered methodology to distribute doses across the state. What's also interesting, and I'll say this generally speaking, is that healthcare providers need to ask for doses of the counties. I think at this point, and I can only speak for Stanford Healthcare ValleyCare on this particular front, we've had a very positive relationship with Alameda County and the team that is coordinating. So our own pharmacy team and the Alameda County team who's coordinating dose distribution. And every week we have conversations with the county. We tell them how many doses we expect to administer based on resources that we have, based on scheduled appointments that we intend to open. And then the county will then in turn distribute doses to us. They give us an allocation. They generally give us an update a week ahead of time. And for us, that process has been working really well. And one piece of evidence, we've administered over 10,000 vaccines in the last couple months. But certainly the opening of our vaccination pod at the Alameda County Fairgrounds is just one more example of the tremendous partnership that we have between the private sector, between Stanford Healthcare ValleyCare, between Sutter and the county, that we intend to ramp up over the next week or so that each entity has the opportunity to vaccinate a couple thousand people per day. So quite a big jump.
Awesome. So one last question, and then we'll bring back Dr. Scott and just open it up to for both of you. Someone here just wants to confirm that phase 1B is now active and open, so food and agricultural workers can get vaccinated now. They can find one, but they're now eligible.
Yes, that is correct. And actually, food and agricultural workers, teachers, and law enforcement, I'll use those three groups collectively, is very much a priority for the county, as it is for all of us. But in direct conversations with our county partners, they're really excited about the opportunity to bring those groups now into the vaccination eligibility structure. So in terms of how do you get an appointment? I'll say the easiest way to do it is to go through that county website and to seek an appointment opportunity within the fairgrounds. And whether that's through the county's channel, Sutter, or Stanford Healthcare ValleyCare, we are all offering appointments. The county may have more appointments available, but absolutely opportunity to go through that footprint, the Alameda County Fairground footprint for vaccination for these groups.
Okay, and just one last clarification here. Food workers includes grocery store workers, restaurant workers. Okay.
That is my understanding.
Okay.
I think for health systems, the sticky part, I'm just going to say this in full transparency, which is why I'm pointing to the county website. The sticky part for us is validation. We have no way of validating someone's employment status. It's not information that we collect. So age, really easy. And even to some extent, medical condition, specifically for our patients, that's really easy. When we start to get into employment groups, that becomes a little bit more difficult. So oftentimes we rely on the county for communication. They will give us lists of patients that they want us to, or lists of community members that they want us to vaccinate, and we're more than happy to do that. So going through the county website to get information about sort of the inclusion exclusion criteria and accessing an appointment is absolutely the best bet.
Okay, very good. Thank you. All right, so we'll bring Dr. Scott back in. Dr. Scott, are you still there?
Yeah, thank you.
Okay, thank you. Thank you for hanging in there with us. All right, so get your questions in here. This is your opportunity. You have the experts here at your disposal today to ask them real time your burning questions. No, we hear the questions all the time, right? Who doesn't? From your neighbors, from your coworkers, anyone that you might come into contact with virtually, of course. So do send in your questions. I do want to say, Dr. Scott, I am definitely a big fan of vaccines. I am of Native Hawaiian ethnicity, and back in the 19th century, early 20th century, Native Hawaiians were almost entirely wiped out by smallpox back in the day, and that vaccine has saved millions of lives. Thank you very much. And then, of course, the polio back in the early 60s. So I'm a big fan of that. It can only help. The alternative is worse. Of course, there are always risks, but dying or taking a chance there. Anybody else got any questions? Do either of you have any comments? Yes, Tracy.
Yeah, I was going to ask the question of Dr. Scott. This came up in different forums. It's always the question I get from folks, which is side effects. Can you talk a little bit about the side effects of the vaccine, what to expect, and the question I get around side effects, is it worth it?
Yeah, as far as is it worth it? If you don't get vaccinated, you're going to be at risk for COVID-19. And I think that the messaging throughout the last year has been, a lot of it has been really focused on high risk individuals, so older people in particular suffering from the complications from COVID-19. But that's not entirely true. I do see a number of patients who are younger adults in their 30s, 40s, sometimes even 20s, who suffer serious illness from COVID-19, and sometimes it's fatal. So I could not recommend these vaccines more strongly. And I just can't emphasize enough how incredibly fortunate we are to have these extremely effective and extremely safe vaccines available within a year of the virus being detected. It's just absolutely phenomenal, and I think it's a sign of one of the greatest medical accomplishments of our era, for sure. So it's always a matter of weighing the risks and the benefits. So the benefits from the vaccines are what I've discussed at length, that primarily it prevents nearly 100% of the time severe illness caused by COVID-19. I also think that there's a very high likelihood that it will significantly reduce the risk of infection leading to the spread of this virus, which will allow us to see our grandparents again, which will allow us to open up our businesses and socialize with our friends in restaurants. Not right away. I think it's going to take some time, but vaccines are our ticket out of here. So those are the benefits. The benefits are clear. So what are the risks? Well, there really aren't any significant risks. So the side effects that are being so commonly reported are what I wouldn't even characterize them as side effects. I think they're intended effects. It's again the immune response responding. So after the first dose, and it's also referred to as reactogenicity. So these are reactions that are basically signs that the immune system is working. After the first dose, it's very common to have pain at the injection site. It's a shot, but it's a very small needle. It's an extremely small dose. I personally didn't find the pain at the injection site to be any more uncomfortable than your average flu shot. The pain went away after 24 or 48 hours. And sometimes people have swelling. Sometimes people have lymph node enlargement after the first dose. But most of the more sort of pronounced or dramatic reactions occur after the second dose, the booster dose. And I don't think there's any reason to be alarmed, but it is important to be prepared. So it's quite common to have flu-like symptoms, basically, for 24 to 48 hours. So fever, low-grade fever, typically around 100 to 101 is quite common. Fatigue, headache, muscle aches, etc. I don't recommend prophylactically treating these reactions with something like Tylenol or ibuprofen. If someone gets the second dose and they're just really uncomfortable with fevers and aches, I think it's okay to take a small amount of ibuprofen and or Tylenol. But for the most part, again, it's the immune system working. The immune system works more efficiently at a higher temperature. We've evolved to have fevers in response to various infections. And these reactions are not going to be a sign that there's infection going on. These are signs that the immune system is cranking out antibodies and producing, various immune cells, and there are a lot of sort of chemical reactions that occur. And this is all taking place primarily in the nodes and in the immune cells around the injection site. This is not some wide. The vaccine itself doesn't distribute throughout the body. So it's important to be rest assured that these are common reactions that will resolve on their own.
Okay, now we've got some questions coming in here. We've heard lots of optimistic announcements and pronouncements, but when do we today expect vaccines to open to everyone? Given the information we have today. I know I've heard Biden has made an announcement and others. And
Right. My intelligence is probably as reliable as yours and what we hear on the news, which is that the Biden administration has been successful in securing another 200 million doses, which would mean that everyone who wants a dose would be able to be vaccinated by this summer. And so that to me is the time frame that I'm wrapping my head around. And I think it does sort of follow what we're hearing, at least in terms of the next set of tiers or the next set of groups of individuals opening up in terms of eligibility beginning last week, certainly beginning the early part of March, as I described, based on the CDPH framework. So, I think that that March to June timeframe will really be promising for the group. But again, that could change, as we know. All things with COVID. Yeah, all things with COVID changes. But that's what we're planning for in terms of our vaccination programs. We're thinking ahead through really that July 4th timeframe, in terms of our operational planning period for how long we would operate these vaccination sites in the way that we're doing right now. I think the expectation following that time frame is that the access to supply and the distribution channels are much more seamless, and that patients would be able to receive their vaccinations through their general physician practice, similar to how most people get a flu shot, or through Walgreens or CVS. Again, similar channels to how folks get their flu shot.
Okay. I think Dr. Scott, this is for you. If you've had COVID-19, do you recommend receiving the vaccine?
Great question. So if you've gotten COVID-19, you will have some degree of immunity. It's hard to predict how long that immunity will last. On average, it lasts more than 3 months. So if you were infected within 3 months, you could consider delaying the first dose until 3 months after the first day of illness. So that's what the CDC recommends, and I agree. And that's because you're essentially going to be protected for the first 3 months. There are some very rare cases of reinfection within 3 months, but it's quite uncommon. So the next question is, well, how soon can I get my vaccine after an infection? And for that, I would basically consider the infection to be like the first dose of the 2-dose vaccine series. So the reason why Pfizer chooses 3 weeks as a minimum interval is because it takes 3 weeks for your immune system's primary response to settle down to the point where it's ready for another go. So 3 weeks is the absolute minimum. So Pfizer just chose that because they wanted to be able to vaccinate people as quickly as possible and get everyone a second dose as quickly as possible. So that's the minimum interval that I would recommend between infection and the first dose. Otherwise, there might be some interference and the immune system can overlap and could potentially lead to more dramatic reactions. So I would recommend definitely getting vaccinated, even if you've been infected, but I would probably wait around a month or so, and probably no longer than 3 months.
Okay, thank you. And why does the vaccine need to be in 2 doses rather than 1?
Well, that's how it was studied, and it was in the vaccine trials, and that was based on some preliminary data, laboratory-based data, that showed that the durability, how long immune protection lasts, is going to be better after 2 doses. So I do believe that a number of public health experts are arguing that we could potentially postpone the second dose. I don't know anyone that's recommending just a single dose alone. The second dose provides significant protection in terms of longer lasting protection. So I certainly recommend using the vaccines how they were studied, because the results from the studies are just phenomenal. And I'll also say that oftentimes when it comes to studying a medication, the results that we see in trials don't always match reality, because the study volunteers are sometimes, healthcare workers, for instance, who might already be taking a number of precautions. So it's hard to always, extrapolate from studies. But Israel just released some data, I believe just yesterday or the day before, that showed that their vaccines were about 94%. The Pfizer vaccine in particular was about 94% in terms of reducing the risk of symptomatic COVID-19, which matches almost perfectly the efficacy shown in the studies. So basically, I think that the vaccine should be given as they were studied and as they're being recommended.
Okay, thank you. Well, we have about 2 minutes left, so we'll want to wrap it up. If either of you have any final, very brief comments before we close.
Yeah.
Tracy? Go ahead.
Go ahead, Dr.
What's that?
Go ahead.
Okay. Well, first of all, thank you so much. I really appreciate having this opportunity. These are scary times, but I think that there's good reason to be hopeful. This past year has been just so hard on all of us, and I think that these vaccines are going to provide us with a very powerful tool to get through this pandemic. And there is an end in sight in a sense. So hang in there, do your best at continuing to practice the precautions that we've been recommending, wear a mask, practice physical distancing, etc. And I should also say that after you get your first dose, immune protection does take a while. So, once you get your dose, you're still not going to be immune for at least a couple of weeks. So, I have seen some people get infected after the first dose. It does happen. So for now, as long as the levels of COVID-19 are still quite prevalent, I recommend that everyone practice the same precautions they've been taking, and to really consider getting the vaccine. If you have any concerns about safety, etc., be sure to question your sources. And the C has a number of great resources on their website. But it is, in my mind, a very safe and very effective vaccine, and I highly recommend it. I also just wanted to thank Tracy for all the work that she's been doing. And Stanford Healthcare ValleyCare, I think, has done a phenomenal job at protecting our community and providing vaccinations. So thank you.
Thank you. Tracy?
My final comment, Dawn, would be to thank you and to thank the Livermore Chamber of Commerce for this opportunity. We appreciate being good partners with you, not just during a pandemic, but in any time, and certainly to our community. We are here for you, whether it's COVID related or your other healthcare needs. I've said this to the Pleasanton Chamber of Commerce. I will say this to the Livermore Chamber as well. My phone number is pretty accessible. And so if you promise not to call me at 3:00 in the morning, I'm going to give you my cell phone number. Which is 925-453-9076. And I know we're being recorded, but it truly is a genuine offer. We are a community hospital. We are here for our community. I get a lot of questions and phone calls about just how to navigate or what to make of something that they're hearing. And so I'm happy to be a trusted resource in making sure that you get the information that you need from, as Dr. Scott talked about, reliable sources. So please feel free to call me.
Okay. Well, thank you very much, Tracy Lewis-Taylor, Dr. Jake Scott, Stanford Healthcare ValleyCare, and Amos Productions. We hope today's webinar brought more clarity to our viewers as we make progress to control this deadly virus and allow us to begin to turn our full attention to rebuilding our economy. Everyone, take care. Have a good day.
Thank you. Bye-bye.
Thank you.